Well, there's a good chance that no matter how skilled or well-timed the interventions were, they would have bounced off a persistent wall of clients' defenses. Reich's colleagues accused him of saying nothing new, but Reich insisted they weren't applying that knowledge in practice. They were respecting resistance when it appeared in the room. Just like in our first example, the client who was referred to Reich by a colleague who never realized that the client was eternally laughing at the whole process. The same mistake is made today. Some modalities downplay resistance entirely, others acknowledge it in theory but ignore it in practice. This brings us to clinical psychologist and advanced schema therapy supervisor Nadine van der Linden, who explains this issue clearly in her Schema Therapy Made Simple series. I chose her for a reason. With 2 decades of practice and experience supervising hundreds of therapists, she has seen firsthand that ignoring resistance is one of the most common reasons therapy fails. She uses schema language, mentioning modes like the over-controlling mode or the paranoid mode. A mode is simply another word for a part of the personality. Her point is crucial. If the dominant mode or protective part hasn't given its consent, if it isn't on board with the goals you've set, then you can try every intervention in your toolbox, but you'll just end up spinning in circles.
Often when people come to me and they're like, why isn't the schema therapy working? What am I doing wrong? What we will come back to is a fundamental misalignment in the goals that have been chosen and the interventions that match up to those goals, and either what the client really wants for themselves or what the modes that run the show of their life, that drive the bus of their everyday life, believes is the right thing for them. Although it is basic 101 assessment and formulation advice here, you would not believe the number of times it's actually the reason why the therapy isn't working and why you're feeling very stuck with the client. Situation where you're working very hard and you're putting in place all these interventions, whether it's imagery scripting, whether it's chair work, whether it's cognitive restructuring, whether it's schema flashcards, and it will not be working and you'll just be going round in circles. Very commonly what happens is there is a dominant mode, particularly an over-controller mode can be like this, that really isn't on board with the goals that you have made with the client. And it is actually acting in opposition to those goals because it's like, well, for example, I know how to keep her safe. I'm just going to be really rigid and controlling, or I know how to keep her safe. I'm going to be very paranoid and insist on all these safety measures. And in this situation, you really need to go back to working with befriending that mode and trying to understand what its resistance is to finding different ways for the client to be safe. But most often I find that this is being missed altogether, and people have sort of done that professional bird's eye view of, well, this is what's going to help create health for you. These are your unmet needs. These are your schemas. This is what we need to do. But there is no consent from that mode.
There is no consent from that part of personality. In other words, she's saying, don't break Reich's principle. If you jump ahead of resistance, if you intervene before the resistant parts of personality has shown itself and been respected, you'll hit a wall. That was true in Reich's day, it's true now, and it will still be true 100 years from now. Resistance won't disappear. It's not a matter of method or theory, modality or training. It's structural. It's how personality itself is formed. The therapist's task, then, is to recognize resistance and to map how the personality is structured, which parts dominate, which stay hidden, and how they relate to resistance. Even when this map is clear, another challenge arises. How to work with it in practice, with the unique constellation each client brings. Without both steps, seeing the structure and knowing how to work with it, the problems Nadine highlights inevitably surface, or therapy progresses by pure chance. If the protective system isn't respected, the work loops back on itself. Resistance becomes the very center of therapy. blocking the way instead of showing the way. At this point, you might ask, what about the clients who don't seem resistant at all? The ones who never argue, dismiss, or push back, but instead cooperate fully. That's where the good client problem comes in. Let's take a closer look. Take a client who protects themselves through perfectionism. Instead of being openly resistant, they try to be the perfect client. They complete every exercise by the book. On the surface, they appear motivated, hardworking, cooperative. But beneath that, perfectionism is resistance. It's a strategy to avoid pain, to secure worthiness, and to gain approval by doing everything flawlessly. And the moment you touch the motivation behind it, your perfect client quickly becomes a highly resistant one. Now consider another variation, the client who developed paranoid traits, as Nadeni mentioned. Many grew up in hostile environments where anticipating danger was the only way to survive. In therapy, this might appear as exaggerated obedience or fawning. They follow every technique, they seem friendly and cooperative, but your gut tells you something is off. The distrust is still there, just hidden. They're terrified of appearing disobedient, of insulting you with their doubts. So the safest strategy is total compliance. But compliance comes with its own risk, the fear of losing themselves in obedience and contempt, because they might see you as an oppressor. As soon as therapy starts to progress, resistance reemerges, complaints, yes buts, or self-destructive behaviors that undo the work. You're left wondering how it's possible to be back at square one just when everything seemed to be going well. Reich himself admitted that his greatest disappointments came with these kinds of clients. They brought plenty of material, maintained rapport, and appeared flawless in the process, yet ended up in exactly the same place they started. No progress, no explanation, just the invisible weight of resistance doing its job behind the scenes. So let me stress the point again. There is no client without resistance. Resistance is not an exception. It is a constant, built into the very structure of the psyche. The best case scenario is when the client is transparent, when they openly voice their doubts, fears, or objections. That honesty gives us something to work with. From a technical perspective, this is your advantage. You already know resistance will show up. You can expect it, you can normalize it, and, as you'll see in the third module, you can work with it directly. This openness builds trust. It strengthens the alliance, and it fosters an atmosphere where clients feel safe enough to express difficult feelings, supporting both autonomy and growth. Even if what surfaces is unpleasant, it is better voiced than concealed. The more resistance is voiced, the less it derails the process when it hides underground. Resistance is always there. The only question is whether you can see it. And to see it, you need to know what to look for, to get familiar with the different structures of personality. Thankfully, we're not the first ones to ask these questions. In the next chapter, we'll take a closer look.